The information in this video is based solely on my personal experience and is not to be taken as medical advice. My name is Dr. John Kaiser, and I've taken care of people with acute and chronic viral conditions for over 30 years. Beginning with treating AIDS at the beginning of the epidemic, followed by treating patients with Epstein-Barr, chronic herpes virus 6, and now COVID-19, I've learned a thing or two about how viruses behave. Some, like the common cold, are benign. Others, like influenza, extend their symptoms beyond the upper respiratory tract to include fever, headache, chills, and myalgias, or muscle aches. I was recently infected with COVID-19. I was super ill for the first 3 days, could barely lift my head off the pillow, couldn't eat. Then I progressively got better day by day. And here I am, 7-8 days later, almost fully recovered. Here's what I've learned. 1. The coronavirus is a badass, nasty virus. Let me tell you what I mean. The coronavirus feels and acts different. I've dug into the data and looked at the information around how the coronavirus, this coronavirus, came about and where it came about. And I think the evidence is extremely strong that this is a genetically modified coronavirus from bats that leaked out of the Wuhan virology laboratory in Wuhan, China. In the United States government, we've been funding what's called gain of function research on viruses at the Wuhan Virology Center. The whole purpose, I don't know why they were doing it, but the whole purpose was to take naturally occurring viruses, coronaviruses in bats, and to genetically modify them to make them more infectious and more damaging to the host. This was going on. US government dollars were part of it. The FBI has a high degree of certainty that this came from the Wuhan Virology Laboratory. The US Department of Energy has a high degree of certainty that this leaked from the Wuhan lab. In the CIA, 2 CIA assessments say with medium certainty that this was a leak from the Wuhan lab, and 1 CIA assessment with minimal certainty said that this evolved naturally through the wet markets. Don't take my word for it, but I'm telling you, the coronavirus is a badass virus because it's genetically modified. Now let me tell you what it does that's different. You've probably heard of the spike protein. The spike protein is the tip of the spear for the coronavirus. It uses it to pierce through the membrane of your cells. It needs a receptor called the ACE2 receptor. That's all you need to know. Spike protein fits into the ACE2 receptor, and that's how it infects your cells. Well, we have ACE2 receptors all over our body. And what's important here is that we have lots of ACE2 receptors in places where our body already has inflammation. So if there's any heart disease, you have inflammatory disease and you have ACE2 receptors in your heart. If you have COPD or asthma, you have lots of ACE2 receptors in your lungs. If you have arthritis, you have ACE2 receptors in your joint. So the SARS-CoV-2 virus attacks parts of your body that are already weak, that are already dealing with inflammation. This is not a good thing. This epidemic, which we now think has gone away, is still killing 1,000 Americans a week. So we need to take coronavirus seriously. If you test positive, don't expose other people. You may feel fine, but you don't want to expose a mother or a grandfather, someone who's frail. Build resilience before you get sick. What is resilience? Resilience is the ability of your body to withstand acute or periods of chronic stress. That's resilience. Resilience is based on how strong you are when the stress hits. So, if you have a good amount of muscle mass, that increases your resilience. If you have healthy adrenal glands, that increases your resilience. And if you have a healthy gut and a healthy microbiome, that increases your resilience. Resilience is in the bank. It's a bank account. Once you get sick, that's what you're drawing off of. That's what you're leaning on, is your resilience. So you need to build resilience before you get sick. So going to the gym, eating right, getting enough sleep, taking the right vitamins, not being under too much stress for too long. Build resilience before you get sick, and it will serve you. Number 3, your body has a finite amount of energy. Now, when you're young, in your 20s or 30s, you might think energy is limitless. But as people get older, and certainly if their health declines, your body has a certain finite amount of energy to deal with. When you get an infection, one of the reasons you need to lie flat and head on the pillow for hours at a time is because your immune system needs all of your energy. So it takes it and it uses it. It prioritizes, and you have none. When you're not feeling well, use your energy wisely and take periodic rests to store it up. It's like charging when you rest. Now, when it comes to resting and energy management, I want you to know that true resting and true giving your energy to your immune system is something that you can't do while you're looking at a screen. If you're looking at your phone or if you're looking at the TV, you're engaging your nervous system. Your nervous system uses a lot of energy. All the energy your nervous system is using to look at those screens is coming at the expense of your immune system. It doesn't mean you can't check your messages, but don't think that if your eyes are on a screen that you're truly resting and giving your energy to your immune system to heal you. During the past 4 years, I've taken care of hundreds of patients who've gotten acute COVID-19 infection. And the first thing they do is send me a message and let me know. And I give them a set of recommendations that I'm going to share with you. And I want to tell you, these recommendations work, they make a difference, and none of my patients has had anything other than a simple, straightforward recovery from acute COVID. So let me show you my recommendations. And finally, lesson 5, rest more than you think you need to. Again, we're talking energy management, not siphoning energy away from your body, away from your immune system to go back to the gym too quickly or to do too many errands the first day you feel better. The most common thing patients with long COVID tell me is, I started feeling better, I ramped up my activity like it was the flu that I was getting better from. And 2 weeks later, I crashed. Let your body do that deep healing that it needs to do for this genetically modified virus. Let it make sure it's 100% out the door, and then you can go back to your normal activities. So I'm Dr. John Kaiser. It's been a pleasure chatting with you today, and I hope you come back and check out some of my other videos.